Oncology questions 1. 1. A nurse reinforces discharge instruction to a client who had a mastectomy with axillary lymph node dissection. The nurse tells the client, do which of the following? 1. Avoid the use of insect repellent. 2. Cut cuticles on the nails carefully using clean cuticle scissors. 3. Wear protective gloves when doing the dishes. 4. Avoid the use of lanolin hand cream on the affected arm. The correct answer is 3. Wear protective gloves when doing the dishes. 2. A client is receiving a course of chemotherapy on outpatient basis of the diagnosis of lung cancer. The nurse reinforces which of the following home care instruction to the client? 1. A bathroom can be shared with any one of the member of the family. 2. Urinary and bowel extra are not considered contaminated. 3. Disposable plates and plastic utensils must be used during the entire course of chemotherapy. 4. Contaminated linens should be washed separately and the wash second time. The correct answer is 4. Contaminated linen should be washed separately and then washed a second time. 3. A client complains of sore of mouth 10 days after receiving chemotherapy. What nurse diagnosis is most appropriate from this assessment data? 1. Alteration in nutrition. 2. Impaired tissue integrity. 3. Pain. 4. Infection. The correct answer is 3. Pain. 4. A nurse is caring for a client with bowel cancer who recently received a course of chemotherapy and has developed stomatitis. The nurse provides instruction to a client about the condition and determines the need for further teaching if the client states which of the following. 1. I need to drink foods and liquids what are cold. 2. I need to avoid foods with spices. 3. I need to maintain a diet of soft food. 4. I need to avoid citrus fruits and juice. The correct answer is 1. I need to drink foods and liquids that are cold. 5. A nurse is caring for a client after modified radical mastectomy. Which of the following assessment finding would indicate that the client is experiencing a complication related to the surgery? 1. Bloody drainage in the Jackson Prutt tube. 2. Pain at the incisional site. 3. Complaints of numbness near the operative site. 4. Arm edema on the operative site. The correct answer is 4. Arm edema on the operative site. 6. A nurse has provided instruction to a client who is receiving external radiation therapy. Which of the following, if stated by the client, would indicate a need for further instruction regarding self-care related to the radiation therapy? 1. I need to avoid exposure to sunlight. 2. I need to wash my skin with mild soap and pat dry. 3. I need to apply pressure to the irritated area to prevent bleeding. 4. I need to eat high protein diet. The correct answer is 3. I need to apply pressure to the irritated area to prevent bleeding. 7. A nurse is caring for a client with colorectal cancer who underwent resection of the tumor with creation of colostomy. The nurse assesses the stoma post-operatively. Which of the following would the nurse expect to note? 1. A pink dry stoma. 2. A red moist stoma. 3. A pale colored stoma. 4. A dark colored stoma. The correct answer is 2. A red color moist stoma. 8. A client with leukemia receiving a course of chemotherapy and the nurse is told that the client neutrophil count 600 mm³. The nurse provides which of the following instruction to the client about home care? 1. Avoid eating a raw food or vegetables. 2. Avoid aspirin or medication that contain aspirin. 3. Avoid staining bowel movements. 4. Use an electric saver of saving. The correct answer is 1. Avoid eating raw fruits and vegetables.